It's really important to hear what he has to say because, Boris, he does have a peculiar political genius, and he was our prime minister, and not everything he did was completely wrong. He's definitely getting it in the neck this week, and I have myself made quite harsh criticisms. But it is going to be interesting hearing his side of the story, and he has some good points to make, I think.
He felt it was his duty to consider whether lockdowns did more harm than good, and that he was weighing the kind of economic impact of locking down. Is that a reasonable defence? Was he in a bind here? And, it's a reasonable defence to say that he put it off as long as he could.
Listen, it was 100% right. It was a hell of a thing to lock down the country, and that any prime minister should look really closely at that decision because it's going to hit people really hard. I think the two things that spring out of that, though, is firstly, Boris's own consistency was a problem. He didn't stick to decisions very easily, and he told different people different things from minute to minute. Secondly, the economic analysis, I'm not sure if I ever saw any of it. The Treasury never produced a paper, as far as I know, and what has been published to the public is not very thorough about how that economic analysis was done. So I think there are still outstanding questions on the points that he's making.
Well, and what's caused particular anger this week, and it has done before when similar comments were raised, was this idea that he said that older people should accept their fate as a way of avoiding a second lockdown. And he described the pandemic as nature's way of dealing with old people. And on that point, he says in these excerpts from the witness statement, "It is true that I've reflected, no doubt out loud and no doubt many times, about whether the lockdowns would do and did do more harm than good. I believe it was the duty of any pragmatic and responsible leader to have such a debate, both with himself and with colleagues." I mean, there is a lot of anger, isn't there, about his comments about the elderly. That's not going to abate, is it?
Well, I think there were three issues with his comments. Having that debate in the outset was an important debate to have in policy terms. It might sound very hard-hearted, but I think it's fair enough to have that debate. But he kept coming back to it, and there were three problems with that. Firstly, a lot of his arithmetic was just plain wrong. Secondly, although it's true that it was elder people who were dying initially, the disease did work its way through the demographics, and if it had been let rip, then younger people would have died. And thirdly, the real issue that all countries faced was a breakdown of the entire healthcare system. The worry was of course that elderly people would die, but also that many more people would die if there were queues at hospitals and bodies piling up in the corridor.
Right.
And I think he sometimes missed that point.
So this witness statement doesn't sound like it's worth the paper it's written on.
No, listen, it's really important to hear what he has to say because, Boris, he does have a peculiar political genius, and he was our prime minister, and not everything he did was completely wrong. He's definitely getting it in the neck this week, and I have myself made quite harsh criticisms. But it is going to be interesting hearing his side of the story, and he has some good points to make, I think.
Well, we've heard all sorts of pretty horrifying things this week. I'll come back to the culture in Downing Street in just a moment. But one of the things that affected your department was this revelation that Matt Hancock, who ran your department, wanted to, and I quote, ultimately decide who should live and who should die, rather than the medics making those decisions if, God forbid, we had come to that point where care had to be rationed in that way. Did that reflect the Health Secretary's attitude during that time?
It absolutely didn't. I just don't recognise that description at all. It's up to clinicians to decide what medicines are prescribed, what pathways are prescribed, what triage is applied. And ministers respect that. Ministers don't want to get involved in that conversation because we're not the experts and we're not fit to make those decisions. And I just don't recognise the suggestion that any minister was trying to take ownership of those kinds of decisions.
Well, why would the NHS make those claims then?
Well, it wasn't the NHS. It was specifically Lord Stevens, and the way in which he described it. Yes, the NHS CEO, and the way he described it. I wasn't in the room for the incident that he described, and I haven't met anyone who has repeated the evidence he gave.
Well, so I said the inquiry this week did lift the lid on an extraordinarily toxic culture in Downing Street, routine, in fact, daily flouting of the rules, it's claimed, abusive comments towards women, a sort of macho environment. Are you ashamed at what you heard at the inquiry? Do you feel sort of tarnished by association with that government at that time?
I think my overriding feeling was one of being very impressed by the people I worked with in the department, with the NHS, with social care, with the life sciences industry. When I left the pandemic, I was so impressed by the behaviours and the expertise of the people I worked with. And yet, but to answer your question, when I reflect on what the culture was in Downing Street and the things that I read, yes, I do feel that we were let down. I was let down, and I don't like to read about the behaviours that went on there. You're right.
Do you feel ashamed of it?
Ashamed? Do I personally feel ashamed of something that I didn't participate in? Not sure. I definitely feel that we were all let down, and to the extent that I was a minister in that government, yes, I suppose I'm pretty unhappy about it.